Good evening, I'm Ian Hannah-Mansing. Tonight, the federal health minister says governments should get ready to talk about vaccine mandates.
What will make us move through this crisis is vaccination.
Who's already saying no way? And pharmacists say Canadians are getting choosy about their booster.
They may cancel their appointment, they may walk out.
What you need to know before getting your third dose. Plus, outbreaks hit some of the most remote communities in this country.
We're almost at the breaking point. I think people are exhausted.
The calls for help from an Ontario First Nation where almost half of the residents are sick.
They call me Mr. Tibbs.
He broke barriers, changed Hollywood, and inspired generations.
Well, we have this problem. I fell in love with your daughter.
The enduring legacy of Sidney Poitier. This is The National. As the Omicron wave crashes across Canada, healthcare systems are being pushed to the brink. In Ontario, more people are in hospital with COVID now than at any point in the pandemic. And the most severe impacts are being felt disproportionately by people who aren't vaccinated. And that picture is clearest among the province's sickest COVID patients. Fewer than 20% of people in Ontario remain unvaccinated, and yet they make up nearly half of all patients in intensive care. That disparity is driving a growing sense of frustration, and today, Canada's Minister of Health said vaccine mandates could be coming. But making vaccines mandatory is up to the provinces, and some have already made it clear that's not going to happen. Ellen Morrow now with the federal health minister's comments and the frustrations echoed by many Canadians.
Michelle Mannering was eagerly waiting for surgery next week to treat a precancerous condition, but the procedure has now been postponed indefinitely.
My worry is, first of all, is it going to get worse?
Mannering is frustrated with those refusing COVID vaccines and placing a heavy burden on hospitals.
I'm speaking to you, person who's unvaccinated. You could have stopped this. Somebody who really, really needs that surgery is denied it because these beds are taken up by the unvaccinated.
As hospitals teeter, unvaccinated people are overrepresented in critical care wards.
You do see the situation where somebody's unvaccinated and say, that was potentially preventable. And that's where there is frustration and frankly some sadness.
Addressing the crisis, Canada's Minister of Health weighed in on mandatory vaccination laws, saying he thinks provincial and territorial governments will eventually be forced to consider the idea.
What will make us move through this crisis and end it is vaccination.
But in Alberta, it's a non-starter. Premier Jason Kenney tweeting Alberta's legislature removed the power of mandatory vaccination from the Public Health Act last year and will not revisit that decision, period. Saskatchewan Premier Scott Moe wrote, "This is a personal choice, not one imposed on you by the government." Mandatory vaccination laws do exist in some European countries, but those rules are problematic, says this bioethicist.
I worry that turning this into a massive power struggle is probably going to make things worse rather than better.
As Omicron's onslaught continues, pleas to the unvaccinated are growing louder.
If you are an unvaccinated adult, you are going to become part of the Omicron wave that is threatening our hospitals.
Mannering fears a long wait before she knows when her surgery will be.
I just hope that somewhere there's some kind of awakening that people can understand that the vaccines are working.
And Ellen, what more did the federal health minister have to say?
Well, Ian, Minister Duclos said that COVID is going to require longer-term management, perhaps, he said, over many years. That's why he's saying, in his view, provinces and territories may have little choice but to eventually consider measures like mandatory vaccination, because the health minister said this wave shows that even when we have a high vaccination rate overall, a small unvaccinated minority can cause this intense pressure we're seeing on so many hospitals across the country.
Thanks, Ellen. Millions of Canadians have spent the last few weeks scrambling to get a third dose of vaccine as an added layer of protection against the Omicron variant. About 29 million Canadians have received 2 doses of vaccine, but when it comes to that third dose, we still have a way to go. More than 9 million have received booster shots. That leaves about 20 million Canadians still deciding on, waiting for, or not yet eligible for a booster dose. But even when it's their turn, some are expressing a strong brand preference. And as Christine Burak explains, even turning down the shots.
Here's what pharmacists are now hearing from too many Canadians arriving for their shot.
As I got there, and I'm like, well, it's Moderna only, and
Jason Chomick wanted Pfizer. He took Moderna, but pharmacists say many don't.
I'd say about 50% of the people that want to get a Pfizer are not opting to get a Moderna.
As Omicron spreads, health officials insist Canadians need to stop shopping.
Both Moderna and Pfizer are solid, efficient, and safe mRNA vaccines.
The health minister says he got Moderna, and choice is limited. Canada's now receiving almost twice as many Moderna vaccines compared to Pfizer. Over 9 million full doses of Moderna are slated to arrive this month alone.
It's like taking Advil versus Motrin. It really doesn't matter which one you take. They're doing exactly the same thing.
Canada's Vaccine Advisory Committee has said Pfizer should preferably be given to those aged 12 to 29 to lower the rare risk of heart inflammation in that group. The risk of myo and pericarditis has been higher with Moderna than Pfizer, but a recent study out of Denmark followed nearly 5 million residents 12 years and older over 1 year. Researchers found the absolute rate of myo or pericarditis after either vaccine was low, even in younger age groups. Cases were largely mild and there were no deaths.
You've got a very low risk, and you can make a very low risk even lower.
But that's not what Chomick and others are worried about.
I was just concerned because it's so new. Like, am I going to eventually have trouble because I'm mixed?
As this immunologist explains, vaccines aren't like drugs. Mixed doses don't stay in your system.
The ingredients in vaccines are designed to be transient. They're there and then they're used by your immune system and they disappear.
Vaccines leave behind a snapshot of the virus, and already research is showing third doses of both Pfizer and Moderna can boost immune defenses to effectively attack this latest variant. Christine Burak, CBC News, Toronto.
This latest COVID surge is hitting some remote communities, overwhelming healthcare. With cases spiking, the calls for federal help are getting louder. Olivia Stefanovic looks at that growing crisis tonight.
The outbreaks happening now in remote communities are what so many feared when the pandemic began.
We're almost at the breaking point where I think people are exhausted.
1 in 2 people are positive for COVID-19 in the fly-in community of Bearskin Lake First Nation. The closest hospitals are more than 370 kilometers away in Red Lake and Sioux Lookout.
Truth and reconciliation. Where is it? The truth is we're in crisis and there's no federal response.
The community is calling for military help to relieve the few remaining healthy workers who are chopping wood for heating and delivering other essentials around the clock.
My expectation is that this request gets processed extremely quickly.
Tonight, the Indigenous Services Minister says she understands the urgency. The department is providing over $1 million for food, water, and isolation units. But the community says that only covers the cost to fly those supplies up.
We're going to be there for Bearskin Lake for as long as it takes, with whatever it takes.
We have never had this many cases of COVID-19.
The Omicron variant is causing unprecedented outbreaks. Nearly half of communities in Nunavut have active cases.
We know that overcrowding is contributing to the rapid spread.
If there is one silver lining, after the federal government prioritized northern and remote areas for vaccinations, the head of the Canadian Medical Association says they're doing their job.
The vaccines are holding up very well in terms of severe outcomes like hospitalization and death.
The federal government says it continues to monitor cases closely and is moving as quickly as it can to meet the needs of this unfolding crisis. Olivia Stefanovic, CBC News, Ottawa.
Ottawa says nearly a quarter of the 130 passengers aboard that party flight from Montreal to Cancun have returned to Canada.
They were all stopped and interrogated at the border. They were then all tested.
Videos emerged showing the travelers ignoring multiple health measures on the December 30th flight. The federal health minister says passengers could face fines and possible criminal prosecution. At least one of the travelers tested positive for COVID after the flight to Mexico. She is currently there in isolation. Supporters of Novak Djokovic rallied outside the hotel where the tennis superstar is being detained after he was denied entry into Australia for not meeting vaccination requirements. Djokovic took to Instagram to thank fans as he awaits a court hearing to appeal the decision. Meanwhile, Czech tennis player Renata Voráčová is reportedly withdrawing from the Australian Open after having her visa revoked by officials today. Amid violent protests in Kazakhstan, the nation's authoritarian leader says he's given shoot-to-kill orders to his security forces.
Правоохранительным органам и армии.
The comments coming in a televised address to the nation. Some order has been restored on the ground, but this week's anti-government demonstrations have already left dozens of protesters dead and thousands more detained. A Russian-led military alliance now has troops and equipment in Kazakhstan after the government called for outside help. There were cheers outside a courtroom in Georgia today as 3 white men were sentenced to life in prison for killing a black man while he was out for a jog. A warning, we will show some of the moments leading to Ahmaud Arbery's death. As Chris Reyes explains, his family wanted to make sure his story was told today.
Good morning.
Moments before the sentencing, Ahmaud Arbery's family addressed the court with a simple yet searing request.
The loss of Ahmaud has devastated me and my family. So I'm asking that the man that killed him be given the maximum sentence available to the court.
We'll never see Ahmaud again. So I feel they should stay behind them bars the rest of their life because they didn't give him a chance.
Judge Timothy Walmsley made it clear he agreed.
Today demonstrates that everybody is accountable to the rule of law. Taking the law into your own hands is a dangerous endeavor.
Arbery was unarmed when Travis McMichael shot him while his father, Gregory McMichael, watched from the back of a truck. Both were sentenced to life in prison without parole. Their neighbor, William Bryan, who recorded Arbery's last moments on that day in February 2020, was sentenced to life with a chance of parole after 30 years. The judge explained it was because Bryan showed something the McMichaels did not: remorse.
It is obvious from the beginning that he questioned the tragedy.
Outside the courthouse, emotions ran high.
While this is a day of great jubilation for this family, we want to make sure that America realizes that this ought not be an anomaly. It should be the standard.
Arbery's killing happened just months before George Floyd's murder. Both cases mobilized historic protests in the U.S. and around the world. In the courthouse, his family made it clear today was a day to honor their son, their brother.
You should know who my boy was.
We're going to miss his jokes, his impersonations, his warm smile. Ahmaud had a future that was taken from him in an instance of violence.
My heart is broken and always will be broken.
Chris Reyes, CBC News, New York.
Hollywood is mourning a giant tonight. Sidney Poitier broke down barriers for generations of actors and changed conversations about race. As Susan Ormiston shows us, he's being remembered for his remarkable talents and the extraordinary legacy he leaves behind.
The winner is Sidney Poitier.
He broke Hollywood's color barrier, winning Best Actor in 1964, a first for a black man.
It is a long journey to this moment.
Poitier tackled racial stereotypes in movies as a Philadelphia detective taking on a bigoted Mississippi police chief.
They call me Mr. Tibbs.
By 1967, he was wildly popular, playing a London teacher in To Sir with Love.
Mom, this is John.
And a surprise boyfriend in Guess Who's Coming to Dinner about biracial marriages.
Have you given any thought to the problems your children are going to have?
Yes, and they'll have some.
The son of a tomato farmer in the Bahamas was first turned away from acting lessons with a thick Bahamian accent, but he persevered.
I was raised by my parents to be an instrument for change.
His ambition to find roles depicting accomplished, educated black men, he said. Off camera, he championed civil rights, but in the 60s was criticized by some for not going far enough.
We have lots and lots and lots of African American actors. Now, when we didn't have any, I appeared. Not because I brought so much, but because the time was right.
In 2002, the Academy bestowed an honorary Oscar, the same night as Denzel Washington's Best Actor win.
40 years I've been chasing Sidney. They finally give it to me. What they do? They give it to him the same night.
He died in the Bahamas at age 94. Accolades are pouring in. He showed us how to reach for the stars, Whoopi Goldberg, an elegant king, Kerry Washington, and my hero, Dionne Warwick. President Obama, who awarded him a Medal of Freedom in 2009, said with groundbreaking roles and singular talent, he opened doors for a generation of actors. But for many, the lasting memory of Sidney Poitier is one of dignity and grace. Susan Ormiston, CBC News, Washington.
Let's talk some more about the legacy of Sidney Poitier, and we're joined by Cameron Bailey, the CEO of the Toronto International Film Festival, and before that you were a film critic. And Cameron, when you first heard of Poitier's passing, what came to mind?
You know, I was surprised by how saddened and how shocked I was. He was 94 years old. He lived a good, long life. He leaves behind a remarkable career, a groundbreaking career. But I was still so sad to see him go. He was an example, a kind of a guiding light for so many of us.
I only saw In the Heat of the Night maybe a couple of years ago, and even then, like it was so powerful and had such an impact on me. But Cameron, I feel like there's almost no way we can appreciate the impact those kinds of movies had when they first came out.
You know, there was never anyone like Sidney Poitier in the role that he played in popular culture, and there probably never will be again. He came around at a particular moment in American society where the civil rights movement was just getting started in a bigger way in the United States. Martin Luther King and Malcolm X and others were showing the need for urgent change in America when it comes to race relations. And when people went to the movies, and remember, everybody went to the movies in the middle of the 20th century regularly, almost every week. And suddenly there was this beautiful, dignified, powerful presence, a black man on screen who epitomized everything that was going on in the civil rights struggle. And he carried all of that on his shoulders for many, many years through many films.
We have maybe 30 seconds left, and you know, a lot has changed, but a lot hasn't changed. What do you hope his legacy will be?
You know, we've seen so many actors who feel indebted to him. Denzel Washington from the Oscar stage when he won his Oscar thanked Sidney Poitier. Michael B. Jordan, so many other actors today are indebted to him, not just black actors as well. He was an actor who was also a civil rights activist, and now when you see actors taking up causes, a lot of that can be traced back to what Sidney Poitier did many, many years ago.
Hey, quick question. If someone's going to watch a Poitier movie tonight or tomorrow, what should they choose?
Start with In the Heat of the Night, directed by Canadian Norman Jewison. It is a fantastic film and still stands up as a powerful drama.
Absolutely. Cameron, thank you so much.
Thank you.
There are weather advisories in every province across the country tonight. Whiteouts in the east, winds in the west, a brutal blast of winter from coast to coast. Next. And we go beyond the headlines with the Canadians on the front lines of the Omicron wave.
Our staff are burnt out.
We're doing the best that we can.
At times it's moment by moment.
Plus, a new approach to caring for the elderly, aimed at keeping seniors out of long-term care.
So you found a solution that costs less, much less.
Yes.
We're back in 2. So sure, it's winter in Canada, but tonight people across the country are hunkering down as extreme weather hits from coast to coast. From strong winds here in BC to bitter cold on the prairies, and the first nor'easter of the year slamming Atlantic Canada. There are winter weather warnings in every province tonight, huge swaths of the country being hit at the same time, disrupting the lives of thousands of Canadians. Cameron McIntosh walks us through it all.
Already high king tides pushed up further by raging winds pounding Vancouver Island's Qualicum Beach. While on the mainland, the same thing in Vancouver. Waves washing out this pier, tearing up chunks of the seawall, and washing right into this West Vancouver neighborhood.
This is incredible. Never ever seen it like this. This is another apocalyptic event for BC.
Good-natured jokes aside, some did get it worse, with yet even more storms hitting BC. Along the north coast, the Coast Guard had to give a hydro crew a lift to restore power on Campbell Island, while freezing rain downed trees and power lines, knocking out power to 10,000 people in Chilliwack.
It's been a couple of back-to-back extreme weather events here.
On the prairies, it's an abnormally long 2-week cold snap. In Edmonton, minus 27, but with the wind chill, felt like minus 36 today. These guys still on the job outside.
We also have to take a few more breaks throughout the day just to kind of make sure that we do warm up and stay. So we just we'll cycle through just to kind of keep our core temperature warm.
Okay, let's go. Similar story at this Calgary dog park. Those out in sub-minus 30 wind chills today say they've just been cooped up too long.
Weather permitting, today isn't too bad of a day, no wind, so we'll see how it goes.
There's a break coming. The forecast is calling for Chinooks to bring warm air from the west coast across much of the prairies.
Everybody's got their eyes focused on a week from now when we see a January thaw, likely.
That could reach as far east as Winnipeg. Today, minus 26, wind chill minus 41, where CAA was awfully busy.
We've been peaking at about 1,600 rescues in a day, so about 3 or 4 fold of what we're normally seeing on a day like at this time of year.
Earlier this week, no problems like that in snow-free Halifax. Today, that changed. With a winter storm, up to 45 centimeters of snow is expected in some parts of Nova Scotia. The first week of 2022 giving much of the country a taste of some extremely unpleasant weather. Cameron McIntosh, CBC News, Winnipeg.
The cold weather is doubling the pressure on people who are homeless. As Kayla Hounsel explains, Omicron outbreaks are forcing some shelters to reduce access to beds and close doors.
Cold weather and COVID, a potentially lethal combination for people experiencing homelessness. As the city of Toronto declares an extreme weather alert, some shelters are closing their doors due to outbreaks. Thousands of people are living in shelter hotels.
The ventilation isn't very good, so I'm exposed to everything in here. And that's one of the reasons why COVID scares me so much.
Jennifer Jewell is worried there's not enough communication to residents about Omicron and how fast it spreads.
They haven't talked to us about it at all. The staff haven't said anything. There's no notices. There is currently 4 cases that I know about.
She has her own room, but worries about those who don't.
We have COVID ripping through the shelter system right now.
Greg Cook is with a group calling on the city to do more. There are active outbreaks at 34 shelters. N95 masks are available for staff, but not residents. And the number of spaces has been halved at the so-called recovery hotel, where people who test positive are taken to isolate.
The city needs to acknowledge that the system has collapsed and that they need federal help.
Do you need help?
No, we don't need help currently, and certainly the impact for vulnerable people, including people who are homeless, has been significant. But we are prepared.
In Halifax, 6 people have tested positive at an emergency shelter. 1 is in hospital. The others are isolating in hotel rooms, but the remaining guests are isolating at the shelter.
We can't allow new people to come in. Because we're not confident about the area and we don't want to bring anything else into the area.
Advocates say the pandemic has aggravated a problem that already existed, a lack of affordable housing. And they say in this case, a return to normal is not the goal. Rather, governments need to do better. Kayla Hounsel, CBC News, Halifax.
When we come back, changing the way we care for our seniors.
How many would be in a nursing home were it not for the program you operate?
They would all be in a nursing home.
a new approach that could help keep more Canadians out of long-term care. Plus,
one person who I don't even know who they are email transferred me $1,000.
an incredible response to one man's mission to get kids the laptops they need to learn at home. Welcome back. As the pandemic exposes some of the difficulties faced by people living in long-term care in this country, we want to take a look at places where senior care is being done differently. Tonight, the move to change things in an Ontario city inspired by a program south of the border. David Common explains.
B7, B7.
At first glance, you might think this is a nursing home. But this Detroit program is actually designed to keep people out of care.
N35.
Providing day programs, social and medical services to 4,400 people who live in their own home, but can come here as often as they need. Mary Neighbor runs several centers like this.
How many would be in a nursing home were it not for the program you operate?
They would all be in a nursing home, probably.
All of them?
Yeah, probably. If their family couldn't take care of them.
So you found a solution that costs less, much less.
Yes.
You believe provides a higher quality of life.
I don't just believe it. We have research that says it, yes.
Across southeast Michigan, this middle ground option, neither fully at home nor fully in a home, is called PACE, or Program of All-Inclusive Care.
Yeah, here we go. Okay.
Its on-site clinic addresses health issues before they become an emergency, aiming to limit costly visits to hospital.
They're never going to be better, so to speak, but the quality of life will be retained.
The approach also saves the state 30 to 40% off the cost of a nursing home.
How's your breathing right now?
But in Canada, demand for this kind of in-between model far outstrips availability.
That item passes.
Paul Sharman wants to change that. The city councillor for Burlington, Ontario, is motivated by the failings he's seen in long-term care, where his mother developed pneumonia 3 times before she died in hospital.
Everything that could have been done in the community to keep her in health and a better quality of life was not done. And the lesson I learned out of that is that long-term care for me is necessary, but insufficient.
Following the Michigan example, Sharman's brought the PACE program north to downtown Burlington. At this seniors apartment building, they plan to have some health services to reduce visits to hospitals.
80% of patient load is driven by people over the age of 80 years old. So if we can take steps to keep people healthier and in their quality of life better for longer, we reduce the capacity required in the healthcare system.
Sandra Short is one of the first 40 participants, attracted to her apartment because of this.
The view is beautiful of the water, and I love the water, so that was the big draw.
She takes part in workshops and classes all right here.
I love the fitness part of it too. It's good for me, you know, it's healthy, and it's passes the time, you know, being because of the COVID-19.
As PACE expands, even more conveniences come when this first floor renovation is done.
The community room's going to be all renovated. It'll be beautiful when it's done. They're going to have a doctor's office in here part-time, so that'll be great if you want to go, like, have your blood pressure checked or something, you know, small like that. So I look forward to that. Be really convenient.
And Paul Sharman has big dreams beyond a single building because he sees Canada's aging population.
Well, because I'm going to be 80. I see what happened with my mother, and I know there are so many people who are worrying about their parents. We're barely coping. People are saying, okay, we need 30,000 more long-term care beds. And I'm saying, no, we need 100 or 200,000 PACE capacity.
He's convinced this is the model to expand, support seniors to stay out of care facilities and stay here in their own home. David Common, CBC News, Toronto.
As Omicron spreads, there are more sick calls and more disruptions to everyday life.
Frustrating. There's no question. I'm not hiding my emotions. I'm frustrated, but so is everybody else.
Next, a new surge brings new challenges to essential services across the country. Welcome back. At this point in the pandemic, we're all too used to disruption. But Omicron is pushing things to a new level. So many essential workers are getting sick, it's having an impact on everything from law enforcement to food supply to the daily commute. Lindsay Duncombe looks at the growing staffing struggle.
The commute into Canada's biggest city is about to get more complicated.
It's frustrating. There's no question. I'm not hiding my emotions. I'm frustrated, but so is everybody else.
As many as a third of workers who make the GO trains go are out sick or isolating. Starting Monday, the schedule will change, cut back 15%.
We want to spread out the pain so no one customer is impacted the most.
There are so many impacts from Omicron sick calls, and they're all adding up. In Victoria, police officers who normally work office jobs may need to be redeployed to the front line. The Vancouver Fire Department is seeing high levels of absences. Earlier this week, Prince Rupert's fire department had to warn neighboring towns it might need help.
It becomes concerning in a different way, of course, when we're dealing with public safety. You know, that it's a lot different than losing a flight because the aircraft don't have enough crew.
Food producers are worried too. One big concern, what happens if railway workers get sick?
It's typically a time, this time of year where a lot of our grain does get shipped. So just on our own particular farm, that could be an issue.
Delays in processing foreign worker permits could also hurt agriculture.
If you're a greenhouse operator and it's planting time and you don't have enough workers in place, it's very stressful.
These are all new stresses on already stressed supply chains, on schedules, on patients. Even industries that practice disaster scenarios don't have a blueprint for this.
Those are typically, in our planning, are short-term events. Those are not 2 years events.
The situation is changing fast, so presumably shortages could improve as quickly as they developed. In the meantime,
well, let's keep our fingers crossed and hopefully things start getting a little bit better.
Lindsay Duncombe, CBC News, Vancouver.
Well, let's hear more about how Omicron is having an impact on three very different workplaces. Joining us, Cara Pilak is the Executive Director at Oak Park Cooperative Children's Centre in London, Ontario. She's also the chair of the Licensed Childcare Network's Advocacy Subcommittee. Peter Joseph is a paramedic in Lyndhurst, Ontario, that's east of Kingston, and the Ontario Ambulance Committee Chair for the Canadian Union of Public Employees. And Micheline Saint-Hilaire is the CEO of Action Marguerite in Winnipeg. It operates several long-term care facilities. And welcome to all three of you.
Thank you. Thanks so much, Ian.
And Cara, let's start with you. Tell us about the challenges you're seeing at your childcare centre.
Yes, thank you, Ian. The childcare sector has been met with many challenges throughout the COVID pandemic, and specifically during this Omicron variant. We've recently been dealt with the decision that testing will stop in childcare while we continue to operate. So our staff and children can no longer be tested. So that's becoming challenging for us regarding staff illness. So we're having to assume staff and children have COVID and send them home for 5 days. Additionally, our staff are burnt out. They've been working throughout this COVID pandemic. And as some may know, the childcare sector has notoriously low pay. So our sectors, there's multiple issues that are having our sector being burnt out.
Mm-hmm. And Peter, from a paramedic's perspective, let's focus first of all on whatever you've seen that's changed, particularly with the growth of Omicron. What's it been like in the last few weeks?
So the last few weeks, Ian, it's been a challenge. We're seeing an increase certainly in the amount of positive cases that we're responding to. And we're dealing with a lot of staff shortages in the system right now. It's challenging, and Omicron is certainly it's bringing some challenges to the EMS sector, but we're sticking in there and we're digging deep, and we're doing the best that we can.
And have you been out working during this? I mean, does it feel like we all know how transmissible Omicron is? Does it feel a little daunting for you?
It's extremely overwhelming. I personally am seeing an increase in the amount of positive patients that we're picking up on a daily basis. It's taken a mental toll this last 2 years. We're tired. We're constantly being asked to work overtime. And we're taking the overtime because we don't want to see ambulances downstaffed. So we're working hard, we're digging deep, but it's not without mental strain to our paramedics in the province.
Micheline, what about what you're seeing in terms of long-term care?
Yeah, so here at Action Marguerite, we have 3 personal care homes. All 3 are currently in outbreak status, which essentially means that now our residents, as well as our staff, have been infected with Omicron. The cases continue to rise, which means that this really puts us into staffing challenges and, dare I say, crisis. We're managing to bring staff in and have them present. We manage this almost like it's day by day, but at times it's moment by moment. And we're piecing it together. We're counting on our staff who, continue to step up and show up. They're picking up extra shifts. They're working overtime. We're also hiring agency nurses. We're redeploying our staff from other departments to assist where the needs are greatest. People are calling us to say, where I'm a healthcare provider, I'm available, I'm retired now, and I can come and offer my services. But what we know is that this is not sustainable.
Cara, I know there are big issues here, and I know you talk to other childcare centres around the province, but on a personal level, what impact have shortages and just Omicron had on you?
It's been a challenging week for the childcare sector. We've had a lot of recent changes. Like I was saying, the testing has been taken away, but I've had families withdraw their children from the center, and that leaves us with a shortage of funding in an already underfunded industry. If I can echo the other speaker's comment, the childcare sector is also across Ontario short-staffed. We have a shortage of qualified early childhood educators due to the working conditions and the low wages. So we continue to have the same challenges as my fellow colleagues do as well.
And Peter, in a lot of workplaces, people are wondering about, who's going to be sick next or potentially exposed to Omicron and maybe can't come in. What about in your ranks among the paramedics? Are you seeing a lot of absences?
I think we're starting to see an increase in the absences. I think more paramedics throughout the province are being tested positive. But again, it boils down to, we're severely short-staffed, and we always have been. It's a systemic issue that has faced EMS for decades. So yeah, it has an impact certainly on us.
Micheline, maybe we can end on a somewhat positive note. I think you touched on it before, but you are seeing people kind of step up to help.
Yes, they are. As I mentioned previously, the staff are rising to the occasion. People are volunteering their time. But that being said, it's sure it's a positive note, but we know we're well surrounded. Yet the impacts of this staffing shortage are really being felt, and that weighs heavy on a leader's shoulders because we aren't always able to meet the needs of the people that we support in the ways that we know and that we know how to do. And right now, we're not always able to meet the needs in those ways. And so we really need to strengthen our system, both during a pandemic and even outside, if we're going to make it through this wave and beyond.
All right. Well, it's going to be, we know, very challenging few weeks ahead of us. Thanks to all three of you.
Thank you.
With COVID tests in short supply, many cases are now going unrecorded. Some people are asking Canadians to join a community effort to report themselves online, but does it help? Next. As COVID infections soar past our ability to test, case counts have become unreliable. Now there are community efforts to fill the gaps, but does it help? Julia Wong went to find out.
We have identified about 4,752 new cases of COVID-19.
For almost 2 years, Canadians have been inundated with daily case numbers. Omicron has changed the game as provinces scale back PCR testing due to high demand. But many people are still thirsty for COVID-19 data.
The parents themselves do need some kind of measurement.
Software engineer Billy Lowe created reportmytest.ca. People can log rapid test results and link them to schools, since many provinces are no longer tracking school infection numbers. Lowe says parents want that information before deciding whether to send their kids.
For the children, for the older children, they probably have to make it themselves and say, listen, is it worth the risk?
It's one of several websites that's popped up, like rapidreport.ca, where anyone can submit a rapid test result. Canadians are not required to report results, even though many are now relying on them to test for COVID-19.
I think it's really unfortunate that citizens have to step in when the government decides not to or doesn't have the resources to do something.
Noah Little is the founder of COVID-19 Tracker, which days ago launched a rapid test tracker. He says it's meant to supplement official numbers.
I think that there are a lot of challenges with this type of data, but that doesn't mean there's not value there.
Surveillance data is critical, says epidemiologist Cynthia Carr. But she says these portals may not provide an accurate picture, and the context of a case is important as well.
Well, not all data is actually better than nothing if it's not good data.
Carr stresses people should not use these portals to gauge the risk of catching COVID-19 or to make important daily decisions. Julia Wong, CBC News, Edmonton.
When we come back, a Toronto man trying to bridge the gap created by online learning.
A young guy who called me and he was crying on the phone like an hour ago. So I'm like, give me your address. I'm sending you a computer.
His act of kindness will be our moment. During the darkest moments of the pandemic, so many of us have felt like there's not much we can do to help. But a Toronto real estate broker begs to differ. With Ontario schools back to online, our Memorian wanted to help bridge the gap for kids who don't have access to computers at home. So he started a fundraiser that blew up. It's our moment.
So I put a call out on my stories and it was 6 a.m. on Monday or Tuesday. And within 10 minutes, I had $6,000 that I needed. And then all of a sudden I got another $1,000. And by the next day, noon, we had $26,000 just over 24 hours. So immediately I went and bought the 60 Chromebooks right away. One of our team's clients, Rachel, so she called me and she's like, hey, these kids need something. I'm like, cool, what do they need? Let's do this. And we did it. When I found out that the kids at the same school 1 week into online learning still don't have a device, I'm like we got to do something. Honestly, it just immediately broke my heart. I couldn't believe that in 2021 or 2020, there are kids that don't even have access to a simple device. This is the first time I'm not crying in the past 3 days. 350-pound giant Armenian man who's not supposed to have any emotions, but it's been a crazy emotional couple of days.
I'm not exactly sure it works like that. I think, if he was smaller, it doesn't mean that he'd be more likely to be in tears. But in any event, what a great thing. Those computers now belong to the kids. They don't have to give them back. And he's going to try to set this up as a charity and do more of this in the future. And I think there are lots of people out there who are potential donors. That is The National for January the 7th. Join me Sunday for Cross Country Checkup on CBC Radio 1 and CBC News Network. And later that night, right here for The National. Good night.